Aesthetify. Hey guys, this is my channel Aesthetify, and this is your host Idris. I'm here today to talk about one of my favorite compounds, Superdrol. Now, Superdrol was one of the very first cycles I ever did. Before I ever touched injectables, I did an oral-only cycle of Superdrol, and that was when I was around 18, 19. And back then, this was in the early 2000s, you could buy the stuff in your neighborhood supplement store. It was purely legal before they had this big pro-hormone ban. So yeah, that was kind of awesome. It was good times back then. So Superdrol, one of my favorite compounds. You know, you can dose anywhere from 5 milligrams all the way up to 40 milligrams. I would suggest not going as high as 40 milligrams. The side effects can be pretty severe at that dosage. I'd like to go anywhere from 5 to probably max about 20. I'm actually taking Superdrol right now, but I'm not taking it on like a everyday kind of thing. I'm taking it as like 5 milligram pre-workout, maybe 3 days a week at the most. You know, every second day, something like that. It's not really a set schedule. Superdrol has, it's very structurally similar to a very popular steroid called Masteron, except for that it has an added methyl carbon group at the 17th carbon alpha position. And, you know, that's very common addition that we see in a lot of these orals. It's so that it can pass the first pass metabolism, and it's bioavailable upon oral ingestion. Unfortunately, adding this methyl group does make it liver toxic, and with Superdrol, it's actually got a dimethyl, so it's actually a little bit more toxic than your typical oral. But yeah, so there's a lot of benefits to Superdrol. Number one being the massive glycogen retention. 2, get very good strength. You know, I could see getting 20 to 25 pounds added there on the bench press there. It's very fast acting, but it's also got, you know, you could gain probably about 15 to 20 pounds on an oral only cycle if you diet properly and you stay committed in the gym there. I can see that for sure. But Superdrol's also got quite a few negatives. As I said, it's got the dimethyl, so it's quite hepatotoxic. A lot of people refer to Superdrol as lethargy in a can, and you know what? I would have to agree with that. And it can be quite taxing on the lipids. A lot of people think the lethargy comes from the toxicness of the compound, but it's actually because it's a strong inhibitor of the 11B hydroxylase enzyme. And when this enzyme is inhibited, you get a decrease in cortisol and actually an increase in a potent mineral corticoid called dehydroxycorticosterone. And when this is increased, there's actually a good chance of getting something called hypoglycemia, which is just very low potassium, and that is believed to be the cause of the lethargy. And you know, a lot of people, they also talk about this mystery gyno that some people get. You know, they usually get it upon cessation of the Superdrol, you know, quite well into the post-cycle therapy. And which really doesn't make sense because, first of all, Superdrol doesn't aromatize. But it's thought that because it's such a strong 11B hydroxylase inhibitor, upon cessation of the Superdrol and the cortisol synthesis starts increasing again, there's thought to be an intermediary metabolite of the cortisol synthesis that actually turns into progesterone, thus causing breast tissue growth. So I thought that was a pretty interesting theory, and it could make sense because it doesn't make sense in the other pathway of the estrogen pathway. So yeah, I thought that was pretty interesting. Um, but yes, if you want to do Superdrol, I would definitely recommend that you take a couple like protective supplements. One being ubiquinol, that's the active version of CoQ10, very very good for the heart and kidneys. Number two, Tudka, very good to take Tudka. I would say it's one of the best liver supplements. You know, it's a bile salts, very good, very good for the liver. You almost always see liver values return to normal upon taking Tudka. And three, maybe add some milk thistle in there, and then four, because because of the strong 11B hydroxylase inhibition, and that also causing water retention, and that's not to be confused with bloat. Water retention and bloat are different. Bloat is subcutaneous edema, because Superdrol does actually cause quite a bit of water retention, and yes, so that means that you're gonna definitely have increases in hypertension. So you're probably gonna want to get on a blood pressure medication there. I would suggest maybe something such as telmisartan. That's one of the better ones. But yeah, that's it for today, guys. Thanks for your attention, and we'll talk to you later. And don't forget to subscribe.